Okay, 19-year-old male, sudden severe left testicular pain. Testes is swollen, tender, positioned higher than the right, and the cremasteric reflex is absent, reduced blood flow. Which of the following arteries is the source? So this is going to be a blood supply question. Okay, so there's testicular torsion, and that's the twisting of the spermatocord, blocking the blood flow to the testes. And so that's going to be a problem because the testicular arteries arise directly from what? The abdominal aorta, just below the renal arteries. They travel through the inguinal canal inside the spermatic cord to the testes. And so you need orchoplexy. You need immediate surgery within 6 hours to save it. So the common iliac artery, that gives rise to the external and the internal iliac arteries, but does not supply the testes. Those are directly from the abdominal aorta. External iliac will then become the femoral artery, and that will supply the legs. So you have your common, and then your external, and then your leg. And then there's the internal pudental that supplies the penis and the scrotum, not the testes. There's the obturator supplying the thigh and the thigh muscles and the pelvis, not the testes. And the renal artery supplies the kidneys, but not the testes, obviously. Just the kidneys. Now, what people think sometimes is Nutcracker syndrome. And that's when the left renal vein gets compressed between the aorta and the SMA. And it's like a nutcracker. And so it blocks the blood flow and it backs it up. So if that left renal vein is compressed, then blood gets backed up in the left gonadal vein, and that leads to left-sided flank pain, left varicocele, so dilated testicular vein, a bag of worms, hematuria, blood in the urine, and so that would be like flank pain, compression on imaging. So that's Nutcracker syndrome for you. Sometimes people like to ask questions about that. That's the irregular part on the left side for the vein system, not for the arteries, which come from the abdominal aorta. Okay. We'll see you in the next video. Like and subscribe.